Well, let me shift gears a little bit and become more church-centered and specifically Episcopal Church. One of the common questions will be the use of the common cup, and in the Episcopal tradition, it is always permissible for people to receive communion in one kind, whether that's the bread alone or of the cup alone. That is always permissible. We have traditions of drinking from the common cup, traditions of intinction. I want to talk to you about that whole collection of quasi-theological health issues around the common cup.
Well, I like the issue of traditions. Obviously, I'm Episcopalian. I like this idea that we are based on our traditions. And here's what I'd say. At this point, with H1N1, with the novel virus, we're saying a lot depends on personal responsibility. The personal responsibility to stay home with an illness with fever, the personal responsibility to wash hands frequently, the personal responsibility to cough into a sleeve, and to maintain distance. At this point, in churches across the diocese, I would say that the ill individual stays home, or if an individual who thinks that they might be becoming ill chooses not to receive from the common cup, they're exercising great personal responsibility. There's no reason to not come together and congregate and worship together. If the virus becomes a bit more common, moves to that endemic or epidemic, and if it becomes more severe, it moves to pandemic, you'll see us change those recommendations. You'll say we should be wary of social gatherings, or people in risk groups should be wary of those social gatherings so they don't become...
And we're not there.
We are not there yet. To go to the common cup, hate to disabuse people of what the myths and the rumors are, but there are studies out there where they spray influenza virus on different surfaces and see how long it takes the virus to go away. On metal surfaces, and that includes gold and silver, the virus can live a good 6 to 8 hours if it's not sanitized. The idea behind sanitizing is, again, to use a good soap mixture or a dilute bleach mixture, and to dry the area. It's not how wet it becomes, it's how dry. So the chalice offers no particular protection from its gold or its silver or its pottery. The protection actually comes in the drying of a virus on a surface. Intinction actually is a little bit harder an issue because we're far more effective in spreading viruses with our fingers than we are in other ways. So I would have to admit that I think it's better that the Eucharistic minister or the priest or deacon be the one to intinct and rather than having so many fingers potentially touch the bowl, to have only one. And the individual who does that knows when they may have gotten their fingers contaminated, when they may have touched lips or touched, and they can specially clean and care for that.
And it's liturgically permissible to just stop, wash your hands, 15 seconds dry?
With soap and water, it's 15 seconds and then dry. With the gels, it's until the gel dries on your hand.
Ah, okay. So they could do that fast.
They could do that quite fast and be back to dispensing the elements, yes.
But if I'm in normal, normal health, not feeling anything unusual, taking of the cup at this time is perfectly fine.
As a public health official and doctor, I would say that we can continue to congregate. We can continue in our traditions of passing the peace and of passing a common cup, unless you are sick or unless you know you have been exposed to someone with an influenza-like illness, and perhaps unless you're in one of the risk groups. And when we say risk groups, we don't necessarily mean risk for catching the virus. We mean risk for having a serious complication of the virus.
Say more about that.
Sure. The ordinary seasonal flu, those most at risk, appear to be seniors and people with heart and lung disease. With the novel H1N1 virus, the highest risk group is pregnant women. For whatever reason, they have had a higher risk of hospitalization and a higher risk of death. The next highest risk is children under 6 months of age. They can't get vaccinated because the vaccine isn't approved at that age. So we have to protect the adults and family members around them. Those are the two highest risk groups. After that, we recommend the vaccination for children between 6 months of age and 24 years of age.
Okay.
And then, if you're over 24 years of age, if you have a chronic health condition. And it seems that people over 65 are actually relatively immune to the H1N1 virus. So, unlike most years where it's, if you're a senior, get vaccinated, this year, if you're a pregnant woman, if you're the parent of a child under 6 months, if you're a child, get vaccinated. If you're over 65, you may be caring for everyone.
Huh. Another question, the peace. At this stage, since we're widespread, we're not at endemic or pandemic or epidemic or any of that. What's your advice on how to pass the peace?
Sure. I think anyone who knows that they are ill or might be incubating and chose to come to liturgy anyway might want to say at the peace, I make contact with you, I make eye contact with you, I see you are here, and I pass the peace. If you are well and otherwise well, you may shake the hand, you may give the hug, you may do as you wish. If the virus becomes more prevalent, if it becomes more severe, we might change that advice, but for now, I think we may pass the peace and we may use the common cup.
What other advice would you have for folk in our churches beyond giving us good advice? What other advice would you give?
I go to the top again and I say, remember, our best protection during a flu season is to not be exposed to people who are sick. We have the personal responsibility to stay home with an illness with fever. Watch that illness. See if within those first 24 to 48 hours it becomes influenza-like. High fever, shaking chills, muscle aches and pains, raspy throat, cough. If it is influenza-like, we recommend you stay home until you've been without fever, without the use of Tylenol or ibuprofen for 24 hours. Usually, that will be 4 to 5 days for an individual. Could be as long as 7 days. If you stay away while you're ill, we'll do much better. Second rule, wash those hands, cover that mouth, maintain a social distance. Social distance is between 3 and 6 feet.
Are we at a social distance
We're
now?
just about at the social distance. If I were caring for you as a patient or as a child, I'd probably violate that 3 feet, and I would know that I'm being exposed. Our chairs are not 6 feet apart. Our pews are not 6 feet apart. But again, think of that social distancing as being something that might cause you to keep your hands at your side, might cause you to not touch your face or rub your eye or your nose. This is how we get the virus to our mucous membranes, more so with our hands than the direct sneeze.
I scratch my nose all the time. I do like this all the time.
It's very hard to change those personal behaviors, but try to maintain those social distances. And then the seasonal flu is already available in our communities. If you're a risk group, get the seasonal flu vaccine. It works. And the H1N1 vaccine will begin to become available in early to mid-October. Again, we'll probably push it out to pregnant women, parents of children under 6 months, school-aged children, college-aged children. We'll probably push it there first. But there will be enough vaccine for everyone who wants a vaccine to get a dose sometime between its availability in October and the end of the flu season, which in North Carolina, flu lasts through February and March.
Dr. Morris, thank you so much.
You're welcome.
God bless.